Welcome back to my channel. Today, I want to talk about fatty liver disease, a condition that affects nearly 25% of people globally. Fatty liver, also known as hepatic steatosis, occurs when too much fat builds up in the liver. This extra fat causes inflammation and liver cell damage. It can lead to fibrosis, cirrhosis, and even liver failure over time. Alright, let's get into the 11 signs that may indicate fatty liver disease. Sign number 1: enlarged liver. One of the most direct signs of a fatty liver is an abnormally large liver. A healthy liver is usually not palpable, with the exception of the very bottom edge. But when fat accumulates in liver cells, the size of the liver grows. Your doctor can detect an enlarged liver by physically examining the abdominal area and feeling the liver span below the ribs. An ultrasound, CT scan, or MRI can also pick up on an abnormally large liver. Sign number 2: abnormal liver enzyme tests. When the liver is damaged or inflamed, certain liver enzymes are released into the bloodstream. It includes enzymes called AST, ALT, and GGT. Elevated levels of these enzymes on blood tests often indicate some form of liver injury. Fatty liver is one of the most common explanations for mild to moderately elevated liver enzymes in otherwise healthy people. Extremely high levels can signify advanced liver damage. Sign number 3: fatigue. Feeling unusually exhausted all the time can stem from poor liver function. The liver plays a major role in energy production. It also filters toxins from the bloodstream. When the liver isn't working optimally, toxins build up in the body and energy synthesis runs less efficiently. Fatigue and sluggishness may follow. Many people with fatty liver report constant tiredness or lack of energy as one of their most nagging complaints. Sign number 4: weight gain. Fatty liver disease and obesity have a very strong association with each other. Having excess body fat, especially around the abdomen, dramatically raises your risk of developing a fatty liver. Once you have a fatty liver, it becomes extremely difficult to lose weight due to changes in liver metabolism. It creates a vicious cycle where fatty liver leads to weight gain, and weight gain contributes to a worsening fatty liver. Sign number 5: discomfort or pain in the upper abdomen. As fat accumulates in liver cells, the liver can become inflamed and swollen. It may cause a dull ache or feeling of fullness in the upper right quadrant of the abdomen, where the liver sits. Some people describe it as discomfort rather than overt pain. The pain may also extend into the upper back or shoulder blade area. If fatty liver progresses to advanced scarring, pain can become very severe. Sign number 6: jaundice. The term jaundice refers to yellowish discoloration of the skin and eyes. Jaundice occurs when there's a buildup of bilirubin as the liver isn't processing and excreting it efficiently. While jaundice can have several causes, it may be an indicator of advanced fatty liver disease. When fat severely disrupts liver function, bilirubin can accumulate and cause this telltale sign. Sign number 7: nausea. When the liver isn't working at full capacity, it may lead to gastrointestinal complaints. These include symptoms like nausea, vomiting, and loss of appetite. The nausea is often described as non-specific, meaning it's not confined to the morning, related to eating, or associated with any one trigger. If fatty liver interferes with digestion and detoxification, nausea can arise at random times. Sign number 8: cognitive issues. Mental fogginess or confusion can mark inadequate liver function. The liver helps remove toxins from the blood that would otherwise cloud our thinking and cause neurocognitive symptoms. Impairment of memory, focus, and concentration may occur with a fatty liver. There may also be mood changes like irritability and depression, as toxin levels affect the brain and hormones. Sign number 9: metabolic syndrome. Metabolic syndrome refers to a cluster of conditions, including abdominal obesity, high blood pressure, high blood sugar, and abnormal cholesterol. Fatty liver disease coincides with metabolic syndrome over 50% of the time. They share underlying causes like insulin resistance, oxidative stress, and inflammation. If you have metabolic syndrome, it's smart to get screened for fatty liver and vice versa. Treating one can help improve the other. Sign number 10: skin changes. With advanced fatty liver disease, you may develop visible skin changes, including red spider veins, yellowish skin, itching, and red palms. These result from the chronic accumulation of waste products and altered hormone signaling due to impaired liver function. Specific skin findings like spider angiomas and palmar erythema are also associated with chronic liver conditions. Sign number 11: high blood pressure. There's a strong association between fatty liver disease and high blood pressure. When fat disrupts the liver's metabolic pathways, it can send signals that constrict blood vessels and raise blood pressure. High blood pressure also contributes to fatty liver progression by promoting inflammation. Managing one can help control the other. If you have hypertension, it's wise to be evaluated for underlying fatty liver changes. Those are 11 signs that could indicate you have fatty liver disease. Again, the only way to know for sure is to get tested. Blood tests, ultrasound, MRI, and sometimes liver biopsy are used to diagnose fatty liver definitively. If you have multiple of these signs, check in with your doctor about getting evaluated. Catching it can help prevent permanent damage.
Remember to subscribe and don't forget to hit the bell icon to never miss an update from Health Guide Zone.